I think it's for two reasons. The first reason is that bioethical or ethical problems, issues in healthcare and in medicine are really very important issues for doctors and for patients. So it's usually about crucial decisions in the life of patients. So that's why it's important to study bioethics. And it's also very important to do it through a dedicated program, because it's really something you can learn to do better. And you can, by experience and by also using approaches that other people have developed, you can improve your, let's say, bioethical decision making. And because they're so important, it's also important to improve that part of medicine and nursing. It's just a very important part of the work that we do as doctors and as nurses and as health workers in general. So that would be my answer.
Okay.
Yeah, well, I think it's the main thing is that you can learn from the experience of people in other contexts. So we are obviously working in a different healthcare system, and we've maybe seen other problems, and we have other experiences that we can bring in to Indonesia. And maybe also we've been working on it for a bit longer already. So we've had ethics departments and people working in ethics for, well, several decades now. I mean, it all started around the 40s, I think, of the last century. So we've been working on it for a bit longer, but the main thing is that we can learn from different contexts. So I would also say we in the West learn from collaborating with the people in Indonesia, because we learn from the different backgrounds. It's important. Yeah. Well, it's a bit similar as with the international collaboration. I think that doctors can learn a lot from the problems that nurses face and the other way around. And we've done various courses in the Netherlands, also with people from outside. So with people from the legal department and people from philosophy, from the social sciences, and you often have very surprising perspectives. So and it's usually very useful to bring in people who are not from your own way of thinking.
Yeah.
So they bring in surprising new ideas about how you could deal with ethical issues. So that, I think, it's very useful to compare those different ways of looking by bringing in the other discipline. And usually, like nurses, they often have very different ways of looking at what patients face, because they have a different relationship with patients. A more day-to-day, every day, in every hour relationship, while physicians are usually a bit more at the distance. So that's what they can learn from nurses, how the everyday, the way people and patients have to live with their disease. Nurses know a lot more about that than doctors usually. So it's useful to have those different disciplines. At least 10 words spring to my mind, but if I can take the one maybe that could be deepest, it would be solidarity and togetherness. So it's the basic idea that we're in the world together, and that we have to take care of each other. So we have to be, and solidarity expresses that very, very well, I think, because it is about being in the world together, and we are responsible for each other. That's what it expresses, and that responsibility for the good lives of everybody. I think that's the basic idea, that we have to improve the life of everybody. That's the basic bioethic idea, I think, and do that together. Yeah. But as I say, there could be 10 other. I mean, thoughtfulness is another one, and giving opportunities to people is another one. But maybe solidarity is somehow covering all of this. Yeah.